So to formally start, perhaps we ask ourselves the question, why is there a need for health communication during a pandemic? Many LGUs are busy with the responsibility of managing the needs of their constituents during a pandemic as they work towards avoiding more infections and further transmission, and health communication may not be on top of their agenda during this period. But how can people become aware of what their LGUs are doing without communication? So we look at the following objectives of why health communication should be done by LGUs, especially in this time of COVID-19. One, communicating during a pandemic informs the public of risks to their health and the impact of the virus so that they can take the necessary measures to avoid risks and exposure. Two, health communication can be used to report ongoing initiatives and also the barriers in addressing the health needs of the public, which can lead others to know how to help. And three, it identifies ways into which constituents can communicate their feedback and complaints to LGUs. The table on the right further elaborates on the need for an effective communication strategy during a pandemic. First, good communication is an investment to earn trust. People become aware of the LGU's efforts and what actions they need to take through good communication. Without trust, LGUs can be exerting much effort which can end up being futile because the LGU has not earned the trust of its constituents. When LGUs are trusted, constituents are likely to follow their advice and use it to make informed decisions. Second, good communication paves the way to bring together efforts to combat the pandemic. With coordinated good communication practices, those in the community who are in a position to help may be encouraged or compelled to help. But let me add that this community of supporters is also maintained by responsible communication. There is a need to show supporters and donors where their contributions are going and who are benefiting from them. Thirdly, given the current media environment, specifically the influence of social media, people can have a lot of ambiguities, agam-agam, and they can be confused on what they should do, what health practices should be done. Should we do tuob, just like what some LGU officials are suggesting? And also, given the fast-changing policies at the national level of government or higher levels of local government units, health communication aims to minimize confusion and ambiguity. In our policy brief, we identified three pillars of effective health communication. The first is for LGUs to develop a coordinated communication policy and strategy. Without this, LGUs may end up with conflicting messages, which can lead to confusion, misunderstanding, and public distrust. According to the USAID, LGUs can consider adopting a five-step communication response plan during a pandemic. The first is to identify a communications team leader or coordinator. Second is to identify a spokesperson. Note that ideally, they should be separate roles. Third, identifying communication needs. Fourth, creating a communication plan. And fifth, monitoring information flow of public response or feedback. In crafting a communication plan, the communication team needs to identify channels for disseminating information and which communication resources are available within the LGU. The team should prepare and execute a schedule of information releases and updates and prepare talking points for the local chief executive or the spokespersons. The COM team also should monitor information flow and the public response, as it will help fine-tune key messages depending on how they are presented in the news media. Spotting and correcting errors as reported in the media should be done in a timely manner. Speculations and rumors should be quashed quickly through regular briefings, bulletins, and updates posted on LGU websites or social media accounts. Usually, it's the LGU's public information officer who serves as a communications team leader or coordinator, as he or she is integrated within the chain of command and is able to manage the flow of information within and outside the response team. This role is different from that of the spokesperson. The spokesperson serves as the face and voice of the LGUs during uh, any crisis situation, COVID-19 response or any crisis situation. The spokesperson is authorized to engage in interviews and allowed to be quoted in the media. The spokesperson must be able to communicate using language understandable to the ordinary person. During a crisis, these three critical areas in the operations of an LGU or any organization for that matter are threatened. First, public safety, kaligtasan ng mga mamamayan at ng kanilang teritoryo, their territorial jurisdiction. Second, financial loss, pagkalugi or pagkawala ng kita. Third, reputation loss, pagkawala ng tiwala sa reputasyon ng organisasyon, ng leader o ng mismong LGU. The comms team and the spokesperson should note this particular sequence as priority areas during crisis messaging. The safety of constituents is the primordial priority before financial loss and recovery of reputation. So in a crisis, all efforts should be directed first towards preserving lives. Only when it is certain that lives are protected, then the two areas can be worked on. All right. Um, Let me just add some points to the previous slide. During a crisis, organizations or LGUs deal a lot with the media. I think everyone knows it by now. And it is recommended in any crisis to have template key messages that can be replied to the media or disseminated publicly that communicate important values that your organization would like to project as values that you espouse. First, during a crisis, is to show that your LGU is aware that there is a crisis. Accepting that there is a crisis implies that your organization is acknowledging that there is a problem that needs urgent attention. A problem cannot be solved if it's being denied. So if you listen to spokespersons during interviews on crisis situations, the first statement is always this: we are aware that. For example, we are aware that as of yesterday, 5 people in our municipality have tested positive for COVID-19. Or we are aware that due to the COVID-19 pandemic, our harvest cannot be brought to Manila because of land travel restrictions, etc. Second, LGUs must communicate a sense of collaboration and their willingness to work with partners. So we are working with relevant partners such as the Department of Health, the Department of Transportation, other government agencies, etc. Third, in crisis messaging, the third is to communicate transparency by updating the public through the media. We will update you as soon as we have new information. We will update you every day at 6 p.m. And that is why there are LGUs that are having their regular press briefings, Monday morning, Friday evening, etc. Or some even every day. I've heard of a city in northern Mindanao. I know of a city in northern Mindanao that does press briefings, where the mayor does press briefings every day. The second component in an effective health communication strategy is constituent communication, responsive communication with constituents and community stakeholders. This includes the regular provision of timely and evidence-based information to their constituents and communicating with competence and the right balance of firmness and fairness, which can come no? And reassure an already worried public during a pandemic. What are some key principles to remember in coordinating with constituents? First, LGUs and other local authorities should communicate leadership by telling their constituents that they're on top of the situation or by working to address the problem. But it's not all talk, of course. It should be backed up by performance. The LGU should tell the public its vision, clear goals and objectives. For example, zero mortality rate by X number of weeks. Or it could be that to be able to provide 90% of the affected jeepney drivers temporary employment, etc. Or to be able to give 75% of households their supplemental cash assistance in 2 weeks. May vision, may direction, no? Hindi puro rhetoric. Communicate the three S's. No? The three S's. First, specific actions that your LGUs are doing, such as may mga checkpoint na ba sa borders na boundaries ng munisipalidad? No? Has the LGU passed a resolution, an ordinance saying that only those with municipal IDs are accepted or can enter the municipality or the city? Meron na bang foot bath sa mga opisina? Are there quarantine facilities already? What's the status of the hospitals, etc.? The second S is statistics-based data should be provided and not rumors or unfounded allegations. How many are the casualties? Is there already community transmission? Third, science-proven health measures to avoid infection. What do we need to do? What does the public need to do? No? Huwag lumabas ng bahay kung hindi kailangan. Magsuot ng face mask. Ito ang wastong pagsusuot ng face mask. Maghugas ng kamay. Huwag magkumpul-kumpul sa plaza o sa tindahan. Second is that messages must be timely and consistent. A communicative leader is time sensitive. No? Information must be disseminated in a timely manner to prevent further negative impact of the pandemic, especially during a pandemic when one day or a few hours can spell a big difference. Another principle is openness to feedback to improve efforts, because the feedback that LGUs can get when they communicate with their public is real, on-the-ground feedback that can help form or improve LGU decisions and policies. For example, ma'am, yung barangay captain po dito ay hindi nagbibigay ng cash assistance. Yung kagawad po dito ay nagpa-party, etc. Karamihan po sa palengke ay hindi nagsosuot ng face mask. No? Leaders must encourage, welcome feedback, and be receptive of suggestions to improve efforts. Don't bash critics. Fourth, LGUs must use language and channels that people understand and actually use. Scientific terms must be simplified. No? Ano yung antibody, antigen? Ano yung PCR, RT-PCR? No? So, LGU, local government units in health comms must be able to simplify those, but not also to dilute the message of those terms. The fifth principle in constituent communication is that LGUs must use language and must use their communication interventions to link constituents to functioning and accessible services. Where can we get the ayuda? Saan ako makakakuha ng ayuda? Where can we get assistance? Direct them to the proper office, but make sure that the office is open, accessible, and functioning. In selecting channels to use to communicate with constituents, LGU leaders must know their community's media landscape. Which media platform is most used? Which is the most accessible? In rural areas or in the absence of mobile signal, what forms of communication are available? No? Will it be the conventional megaphone, no? Or house-to-house visit, or community radio, or local TV station? Accessibility to the constituents, accessibility for the constituents is the priority. not accessibility for the leaders. Are the channels accessible? Will people be able to receive timely messages? Will your messages fit the platform? Advice ba ito or mahabang mensahe? Huwag Twitter kasi ilang characters lang ang kasya sa Twitter. No? Do you have the resources? Mahal mag-produce ng isang TV ad. No? Ang public service announcement naman ay libre. No? I-ere sa local media. It's free to air. But there are also expenses in the production of a public service announcement. So in the end, the tendency of LGUs is to use social media. You know? Advisories, memos, resolutions are posted on the official Facebook channels of the LGUs. But you have to make sure, ideally and hopefully, that most of your constituents are online and have access or have Facebook accounts. The third and the last component is interorganizational communication. Good relationships established prior to the pandemic is crucial, no, are crucial, as these can be used as basis for setting up the communicative context at the onset of a pandemic. Nonetheless, the pandemic is also an opportunity for the LGU to establish new relationships. In communicating with multiple entities, it is important to draw from the LGU's internal communication strategy or the communications plan on who will be the point person to be the link to the external entities. In communicating with external stakeholders, it is crucial to identify who is in charge at the LGU's end. In the context of the lockdown, much communication is conducted online. And this implies that there are limits in terms of contextual cues. No? And therefore, that is prone to miscommunication. It is important to identify relevant channels for communicating with each entity, attuning to the respective differences in terms of context and contextual cues. In implementing an LGU's interorganizational communication plan, partnering with credible sources is critical. The choice of who the LGU would partner with is already a message to the public. So it is important to be selective on which entities the LGU associates itself with, especially during the pandemic. Finally, can we go to the next slide? Finally, how does the LGU see the media? No? As partners or as allies? Our policy brief actually discussed the multiple ways by which the media can be partners that can help LGUs extend their communicative resources. So let me just end by presenting challenges and opportunities, no, opportunity areas to explore with regard to health communication, especially among our LGU contacts or units. No. When we previously presented these recommendations, we realized the following challenges on the ground. In many LGUs, there is still somewhat a lack of awareness on who is responsible for health communication. Of course, who are the primary actors to roll out health communication. There were also reports or complaints on the lack of coordination. Lack of coordination or the lack of communication between national government agencies and the LGUs and inter-LGU coordination as well. The third, as earlier said, HealthCom offers an opportunity to leverage partnerships with academia, civil society, and private sector. And I think as a closing reflection question, a question to reflect upon, is that how can we integrate health communication, you know, especially now that our communities try to work to develop our recovery or our reopening processes. So I think that's a question that we can reflect upon as we go through this discussion and offline discussions in the future. Thank you very much for your time. Thank you.